Hi, this is Dr. Paul Broman with Broman Chiropractic and Wellness, and today we're going to talk about tennis elbow and golfer's elbow. Simply put, this is tendonitis of the inner elbow, which is golfer's elbow, and the outer elbow, which is tennis elbow. So golfer's elbow is usually related to the muscles of the wrist and forearm flexors, the muscles that flex the wrist and forearms. And golfer's elbow is related to the forearm and wrist extensors, or the muscles that extend the wrist, extend the forearms. This condition is usually related to overuse. So golf and tennis can cause golfer's elbow and tennis elbow, but countless other things can cause it. Gardening, weightlifting, yard work, using power tools, using a computer, desk work, things like that. So one of the reasons why this is a difficult condition to treat is because it's really hard to rest these areas. And because it's an overuse injury, if you can't rest it, it lingers, and it's really hard because it'll just kind of hang around and not go away. So one of the things that we try to do is help you identify where you can help yourself, what you can do to self-treat this, and then what we can do at our clinic to help accelerate the rate of recovery. Usually, the main presentation when somebody comes in with this, the most severe pain is going to be right at the insertion point where the tendon kind of meets the bone on the outer or inner elbow. And then you're also going to see more kind of dull, achy pain and muscle tension in those muscles below the joint into the wrist and forearm extensors or flexors. There are two reasons why tennis elbow and golfer's elbow usually are really slow to heal or just don't heal. And number one is they're really hard areas to rest, used with just very frequent daily activity. The other thing is the tendons involved with this condition, the tendons just don't have a rich blood supply like the muscle groups. So that lack of blood supply takes longer for those tendons to heal and recover. So one of the things that we do to help promote the recovery process is try to promote blood supply to those tendons and kind of speed that process along. So therefore, it's important to have a game plan if you want to effectively treat tennis elbow or golfer's elbow. And really, to keep it simple, we kind of put it in two buckets. First off, what you can do for yourself, and secondly, what we can do to help to speed the rate of recovery. First off, for yourself, things that we encourage you to do are limit or modify activity. Obviously, certain activities can't be totally avoided. So we also talk about bracing when necessary. If you need to wear a brace, if there's an activity that you're going to perform that you know is maybe going to aggravate it. We also talk about icing. We also look at the proper stretches, as we talked about, the wrist extensors and flexors, the proper stretches to perform, and we'll kind of direct those. And then eventually rehabbing to strengthen and prevent reoccurrence of this. And as far as what we do at our clinic to help speed the rate of recovery and properly assess it, first off, we're going to look at kind of the mechanics of the elbow joint and make sure there's nothing with an actual mechanical restriction. If there's a problem with the radius or the ulna and the actual movement of the elbow, then that can a lot of times be something that's underlying and festering and just not allowing this to heal if the mechanics aren't correct. So when necessary, we'll make adjustments to the elbow if that's needed. Another thing is we'll do active release technique, or ART, or else trigger point therapy as well, to help kind of release more of these chronic trigger points and these knots that need to be broken up. Dry needling and acupuncture are also really effective therapies that can help to create more blood supply, improve the rate of healing to those hard to reach areas, create some more blood supply to those deep tendons. Another couple things that we do is ultrasound. A lot of times if it's acute and it's really painful to the touch and we can't do some of that deeper muscle work, we can do ultrasound to help stimulate more blood supply. That's more of a gentle therapy. We'll also use kinesio tape. Usually we'll see this in athletes if they know they have to play their sport, they know it doesn't feel great. We can kind of just offload that muscle group and take a little bit of stress off the muscle and tendons at that joint, and that'll help the athlete to be able to feel like they can perform without less discomfort, and hopefully raises their level of performance as well. Thanks for watching. Hope this was helpful. Again, this is Dr. Paul Broman with Broman Chiropractic.